Morning, good afternoon, good evening. My name is Opionethan Nsubuga. Today we are coming to learn about amenorrhea. Amenorrhea is the absence of menstruations. When there is a situation where women or ladies may not be able to see their menstruations. So that situation, it is called amenorrhea, absence of menstruations. That monthly shade of blood may not be seen. So what causes amenorrhea? Amenorrhea can be caused by a category of things. There are those that we call natural natural causes. For example, pregnancy. If a lady is pregnant, she ceases or she stops seeing her periods. Then another one, among natural methods, there is breastfeeding. Like I told you in last video, that for pregnant mothers who are breastfeeding, for the first 6 months, they may not see their periods. Then another natural cause is menopause. At the age of around 45 to 50, women experience what we call menopause. Menopause is a situation when a mother or a woman stops going into the menstrual period. Then we also have lifestyle causes of amenorrhea. For example, if someone has too much stress, ladies who have too much stress, they miss their periods. For example, our women MPs that have been campaigning, pressure that pressure. You see that if you're supposed to go in your periods, but you are at the tallying center waiting for results, I'm sure they never saw their periods. So also ladies, younger girls who are going into exams, that intense pressure or stress causes them not to have periods. Also, those who extremely those who gain weight, extreme weight gain and extreme loss weight, all those people, those categories also may not get their periods. Also, we have what we call change of environment. If a woman changes the environment, maybe she has been in a very hot place, then she goes to a very cold place, she may not see her periods. Then we also have medications, drugs that can cause amenorrhea. You may use some drugs and don't see your periods. For example, when you're using some family planning methods, you may not be able to see your periods. Also, people who take antipsychotic drugs, people who are in Butabika, those drugs that are used there, they are called antipsychotics. So people who use such drugs may also experience amenorrhea. Also, the drugs used to control pressure, people with high blood pressure, there are some drugs that can cause amenorrhea. Also, people who use antidepressants, people who have a lot of depression and take some drugs to kill the depression, such people can also get amenorrhea, may not see their periods. Also, we have what we call, there are some conditions, I can call them disorders that can cause amenorrhea. For example, there's what we call polycystic ovarian syndrome, where the ovary has a lot of tumors, what we can call ebizimba mu Luganda. Too much of tumors in the uterus can cause what we call amenorrhea. Then also infections within the uterus, what we call uterine diseases. For example, endometritis, where the uterus inner lining has an infection. Such people may get amenorrhea. Then we also have abnormalities like, there's what we call Ashavan's syndrome. Ashavan's syndrome, it is where women who always do abortions, when an abortion is not done in a safe way. For example, there is where they use machines or instruments to remove the baby. In other words, the ingrowing baby, when you're doing abortion and they use instruments. So as they are doing the instruments to remove the retains, there is a tendency of injuring the uterus. So when the uterus is injured, it heals by scarring. For example, you have a cut. When that cut heals, there is a scar, it leaves. So when there is a scar develops and various scars develop in the uterus, that's what we call Ashavan's syndrome. So such ladies may not get menstruation, because menstruation, it means the blood is going to come in the inner lining of the uterus. In the next video, I will explain how menstruation blood comes about. So people who have gone through repetitive abortions using unsafe methods, they may result in Asherman's syndrome, which may cause amenorrhea or absence of periods. There are very many other causes, but those are the common ones. So when does a woman seek advice? Or when should you go to hospital that, doctor, I'm not seeing my periods? It's when you spend at least 6 months. A lady should spend at least 6 months without seeing her periods. Then it becomes an emergency that needs a medical concern. But if you don't see your periods for 1 month, for 2 months, for 3 months, please be patient. They will come. Think about the stress, the medications you're taking, the environment, whether you've not changed the environment, test for pregnancy, such simple things. First begin with those before you go to disturb doctors that you're not seeing your periods. And if you're a girl and you are 13, 14, you've not seen your periods, is okay. But when it clocks 15 years, 16, 17, you've never seen your periods for the first time as a younger girl, ask your mother, your father, your parents to go and seek medical advice. I remain Opionethan in Subuga. This is East Doctors TV. Subscribe, find us on YouTube, TikTok. Thank you so much for watching. God bless you.